Scientists have discovered a powerful new drug to cure all chronic illness. And it comes on the end of your fork. It's called food. Not only prevent, but also treat, cure, and reverse most chronic illnesses.
Overwhelming to realize that we don't have to have a population where 50% of us die of heart attacks and strokes. We don't have to have a population where 35% of the population dies of cancer. We don't have to have our elderly people having hip fractures and get demented and being in nursing homes, unable to function.
And your body has a remarkable capacity to begin healing itself, and much more quickly than people had once realized, if you simply stop doing what's causing the problem.
What if you don't want to use medicine, statins, to reduce your risk of heart attack? Can you really use food as medicine?
Yes, you can. And we did find living proof of this. Sharon Kintz is a woman that we profiled, 66 years old, had a heart attack, was told by her doctor she needed to have heart surgery, and she said no. And she basically adopted this plant-based diet. As you can see there, she's been very strict about it. Whole grains, lots of vegetables, been doing it for over a year. So again, Allie,
Wow.
the evidence is pretty compelling, not only in terms of slowing down the progression, but really reversing it. These patients needed to have heart surgery, and then they essentially needed no interventions whatsoever.
In a clinical study of men diagnosed with prostate cancer, Dr. Dean Ornish prescribed a vegan diet, moderate exercise, and stress management. After 90 days without drugs or surgery, the men showed no signs of cancer. Proof, Ornish says, wellness works.
We showed a few months ago, we published the first study showing that you can actually stop or reverse the progression of prostate cancer by making changes in diet and lifestyle. Cardiovascular disease, diabetes, hypertension, all of which are completely preventable for at least 95% of people just by changing diet and lifestyle.
It was thought that once you had heart disease, it can only get worse. And what we found was that instead of getting worse and worse, in many cases it could get better and better. Clinically, he literally couldn't walk across the street without getting severe chest pain. Within a month, like most people, was pain-free, and within a year climbing more than 100 floors a day on a stair mat. We also found that the more people changed, the better they got. It wasn't so a function of how old or how sick they were, it was mainly how much they changed. And the oldest patients improved as much as the younger ones. And the paradox is that when you make big changes, you get big benefits, and you feel so much better so quickly. For many people, those are choices worth making. Not to live longer, but to live better.
How much insulin?
24 at night and as needed in the day.
And now it's 1 week and you're already off.
Everything. I'm taking nothing.
You're out of leptin resistance, out of insulin resistance, everything is healed, and you no longer have diabetes. You also had pretty severe arthritis, particularly in your knees. You had fibromyalgia, which was actually making you quite uncomfortable and miserable, and you had some Lyme's disease. Now you're 7 years old and you're pain-free. How many people you know can claim that?
I have very few, and I work sometimes 12 hours straight, which shocks everybody.
She's healed, and she's in normal physiology, healthy, happy, almost completely pain-free with her arthritis, and no fibromyalgia, and completely normal blood sugar. So she's done with diabetes. People have choices, and we're saying there is a choice. That's really what we're saying. But you have to be willing to change your life. You have to be willing to love yourself enough to heal yourself. Those are the people who really do well in this program.